And so the project aimed to increase the demand for postpartum care as well as improve its delivery. And so we did this by designing with stakeholders participatory interventions that were tailored to the context, sustainable, effective, and replicable. So you can have an idea already of the scale, large scale of the reevaluation. And I'm not going to go in detail in terms of the interventions that we've done, but just to give you an idea of the complexity as well of the evaluation, is that we had a bundle of interventions that were implemented, about 5 interventions in the community and 5 at the health facility level, that were all a tiny bit different between the countries, because obviously we're tailored to the specific context for each country, but that focused around home visits, referrals, community talks, training, incentives, and also postpartum care checklists. So here are the stages that we've done to conduct the Realist evaluation. So we started by constructing a basic program theory, so to describe how the project in its most generic form is intended to work. So this is what it looks like. So really very basic program theory. From there, we developed program theories that were represented by the famous context, mechanism, outcome configurations. And so we used data from our policy and situation analysis that we had conducted before at the beginning of the project. We used baseline data, and we also used 2 frameworks, so one on implementation and one on behavior change, to inform those CMOs. So I just wanted to draw your attention about CMOs before I show you what that looked like on our project. And this is Sonia Dalkin's representation of a CMO. And in her representation, she breaks down mechanism into resources and reasoning. So you put a resources into a specific context, and that would trigger a reasoning in your target participant population, and that would lead to an outcome. And that resource can be the intervention itself or a ripple effect of your intervention, for example. And so I found this particularly useful in terms of doing a realist evaluation to help you with the CMO. So I highly recommend, if you go for realist evaluation, to use a representation of CMOs. So this is what it looked like before we started data collection. We had CMOs for the community, CMOs for the link between the community and the health facility, CMOs for the health facility, and finally, CMOs that were around how do we embed that care into normal maternal and infant care practices in terms of to make sure that we have sustainable practices. So after that came the time to actually test the theory through data collection, analysis, and triangulation. And that required a lot of data. We had 16 case studies across the 4 countries. And within those case studies, we had interviews with women that used, that were postpartum at the time of the project, with the evaluation. We had interviews with community health workers, health facility workers, we had implementers, so at the district level, we had policymakers, we had the official money team implementers as well that we interviewed, and we conducted observations in those 16 facilities. We also used monitoring quantitative data from each facility. We had a very extensive document analysis, minutes from all the meetings related to MOMI. We had health facility logs and so on. And what we did is, towards the end of the analysis, when we had kind of set out what the CMO actually looked like in practice after the intervention, we organized for each country a participatory evaluation workshop where we presented those and we discussed them with participants to further refine them. And so at the end, that leads you to a refined program theory. And so we had individual country program theories, and I'll show you an example in a second. And then we did a cross-country comparisons to come up with middle range theories that could be applied to all contexts. So here are some examples of our final CMOs. That was in Burkina Faso. So in, like how we had split it up in 4 types of CMOs, turns out in real life, it was only 2. So 1 for the community side and 1 for the health facility. And so after we've done comparison between the countries, we were able to come up with those 4 mid-range theories. Again, I will not go into detail about what the theories are. We give them very cool name, in my opinion. So we had the bridging theory that was focused on the role of community health workers in high intervention. The bus theory that was more about the perspective of the women themselves in the community and why they would want to seek postpartum care. In terms of improving delivery of postpartum care, we came up with the motivations by accountability theory. And finally, one of our big and most difficult intervention was to integrate postpartum care to other maternal and newborn health services, and that together is stronger theory. So this is what we've done. Now, in our opinion, why should you conduct a realist evaluation? So there are some advantages for doing a realist evaluation, and it allows you to investigate what works for whom, under what circumstances, but most importantly, why and how. And so it's really good for large-scale programs and complex programs because it takes into account the complexity of intervention and as well the interaction between the interventions and the context. I think as well, with the CMOs, you're able to identify actionable processes of change, as well as facilitating and inhibiting contextual factors. And I think it's likely to be more useful to policymakers than other types of evaluation. And also, we found that with our participatory dissemination events, that all stakeholders found it quite easy to understand once it was all finished and nicely put together. What I really like about a realist evaluation is it's also a way to understand what did not work in your project and why. And because in 2 countries, so in Malawi and in Mozambique, we didn't see the expected impact for the interventions. And we're trying to understand why. And with the CMOs, we were able to really show the path, and we understood that in each country, it didn't work for very different reasons. So it's really adaptable tool that you can use when things don't go well, or as well as expected. Now, other advantages is that it's welcome as a new design where impact evaluation is critiqued. One thing that I really find amazing about realist evaluation is how active and supportive the realist community is. So, for example, you have the Ramesses mailing list that was created by what I call the realist gurus. And it's really an excellent tool. You have a question, you just throw it into the mailing list, and you will have someone that will answer that question or give you access to resources. And a lot of times the gurus themselves are the ones that answer you. They also organize a lot of summer schools. I attended a couple and they were amazing. I was actually able to bring in my program theories and sit down with, for example, Geoff Wong and Justin Jakosh and go through them and get their input on it and what we were doing right, what we should improve, what we should do when we're collecting the final data collection, and so on. And as well, at realist conferences, you usually have roundtables trying to advance the methodology that are very participatory. Finally, my last kind of pro about realist evaluation, and that comes from a very biased qualitative methodology perspective, that it calls for qualitative research. It's really important compared to other evaluation design to have qualitative data, because that's what will help you understand your mechanisms, for example, in the CMO configurations. It will also help you to understand the quality of the quantitative results that you're getting, and as well, obviously, it's really good for triangulation of the data. But it is also challenging. So one thing is that you have the limited conceptual understanding of researchers. So that means you need to invest in capacity building for field researchers and evaluators. And you really need to develop a training curriculum. So for example, what we did is that we organized, the UCL team organized a 1-week training. And then we had to fly everyone to Kenya for it. And then for a whole week, we went through all hard tools, and we also asked all the teams to do a pilot data collection ahead of the training so that they could come with their data and we can really go work on refining hard tools together and make sure that everyone can understand what the realist evaluation is about and how to do it. We also had to, with my colleague, write a very strong and detailed topic guide that were based on the program theories. And we had to give field researchers, a series for each question of prompts and probes, but also explain within the topic guide to the researcher why we need that answer, what we're trying to get at, and why it's important for our CMOs. So you need to plan time for all these extra resources, as well as frequent monitoring and feedback to make sure that you have high quality data. So for example, we had teams that were very qualitative and kind of understood straight away realist evaluation. We had really excellent data. We had some very quant people in some of the countries, and now it's just very, very hard to get that data. So it really required a lot of mentoring throughout the evaluation. Now, in terms of realist interviews, the challenge we had here was the cultural literacy to elicit mechanisms from research participants. And for us, it was particularly challenging with women in the community and some women who were not empowered to think for themselves in the first place. It was very hard to kind of dig into the mechanisms of the behavior in terms of postpartum care. So we came up with this, instead of asking leading questions, we came up with this technique of asking why and how 5 times. So when you ask a question, why did you do this? And they give you a first answer, then you follow up, okay, why did you do that? And kind of do that 5 times. So you don't just get the tip of the iceberg answer, but you kind of dig down, and you need that to be able to come up with the mechanisms for your CM. Now, something that also is would be a challenge for you is the language barriers. So you need to plan time and resources to translate the tools. For our project, we had to translate everything in French and in Portuguese, and we had to support the field researchers in 3 languages. And on top of that, for some of our sites, we had to translate the tools in the local languages. So we had, for example, Mosi, Swahili, Chichewa. So it was quite time intensive. But the good news for the Argentina team is that now the Realist community has made resources in Spanish available, so you don't need to do that work. So it's actually Realist evaluation becoming quite popular in Spanish-speaking countries. And so they've created the equivalent of the Rameses project as the races one. So that's why I've put the website here. Again, so finally, the data analysis with our main challenge during the evaluation. So first you need a really high quality data, like I said, but also when you couldn't test your CMO or your program theory, you had to ask yourself, did we put a wrong theory together, or is it a different mechanism that we didn't anticipate? Or is it that the data is too poor to test? Or is it that just the implementation of the intervention is just too weak for us to see any results? So for that, we needed a tool to assess implementation strength to be able to contextualize our program theories. And so this is what it looked like, for example. So for each country, then we could really understand and help us understand how CMO configuration results and put it into context. Okay, and so the last thing I would say is that it requires careful planning and can be more time consuming and resource intensive than impact evaluation. And that is especially true for the data analysis of the qualitative data, because you need to kind of do like a thematic analysis based on your program theories, but you also have to work out what's context, what's resource, what's reasoning, what's outcome, and then put it all together. And also a lot of data is produced as the result of a realist evaluation. So can you use it all? And for us, we did not use it all. So yeah, so that's it for us. Here are the kind of two main documents. So we have the paper with the program theories, but also our middle-range theories, but we also have a detailed evaluation that we wrote for the EU. And here's our email address as well if you need further questions after that. So that's it for me. Tim and I can take questions.
Thanks so much, Nehla. That was brilliant and super clear. We have some time for questions. I've been putting some in the chat, which we should go to unless someone has a burning one.
How many CMOs is too many?
Raul,
I've not given a number there, just giving some suggested answers.
Just, I will try to be brief, considering that the presentation was super clear, and I think it was also very helpful. And thank you also for your very nice presentation. I want just to know that I'm pronouncing correct. Your name is Nehla?
Yes.
Okay, that was the first barrier. So, no. Well, I like realist, although I have not too much experience with realistic evaluation, besides being in contact with the Canadian experience in some activities that I did before many years ago. I find this kind of evaluation really interesting and challenging, based on the situation that is realistic. So I understand that this is a very interesting issue. The other thing that we are in a particular moment in this project, trying to define ways of evaluation, tools, mechanisms. So listening to you, my question is, if we are on time or not to integrate this approach, considering the particular situation of our project, and considering that we have already generated a lot of information in terms of contextual analysis, situation analysis, child development, practices at the community level. So the question is, is there a time-fitting availability, feasibility? Or I'm asking you and also the rest of the team from Ghana and also the coordinators of the project. So how do we understand that this contribution can be made possible in terms of our particular situation? I think it would be also interesting to get information about your experience, your publications, to understand the whole picture and the kind of problems or barriers that you had with the different countries. Assuming that there are some limitations to access to information in each of the countries, and this can be a very important issue to consider. Another issue, and forgive me for making all these comments together, because I have been waiting all my life to see you this today, so we have to take advantage of this opportunity. And another issue has to do with the situation, the relationship with the community, because what we discuss many times in our group is the evaluation activities. They have a extractive approach. We get information from the community, but no feedback and no participation at the community level. And it seems, listening to you, that the participatory component and the way that the community is supportive of this activity is extremely important for us to provide additional value to the activity in terms of recognizing the need to have the participation of the community and involved. There are some methodological issues in terms of how many. Was the acronym CMOs? No. Yes. So you mentioned that you define 4 CMOs. So how many what was the criteria to define how many CMOs are you going to consider for each project, or which are the main issues to consider to define these areas of understanding? And also another issue that was new for me was the middle range theories that I don't want to lose time because it's going to take too much time, but there are many concepts that you have mentioned that for me are new, and perhaps for some of the participants of this session, that will be important to have an additional time to clarify through a parallel contact after this meeting. Over. I'm sorry.
I can go first, Tim, and then you can take over. In terms of the amount of data and the timeline to do the realist evaluation, the fact that you already have data is good, because you're going to need it to develop your initial CMOs and your program theories in order to be able to go and then test it out during your evaluation. So like I said, we used a lot of data to be able to come up with those initial CMOs. In terms of the timeline, I would say it just depends on your resources, how many researchers you have and how much money you have realistically. So we actually did the evaluation. If I remember correctly, Tim, the pilot took place at the end of May. Then we had the training early June. And then the data collection was going on until September. And then some miraculous speed. I was younger then in terms of processing and analyzing the data. And so we had finished the evaluation by the end of January, and then it took us an extra month to write it up. So it took us from, let's say, May to February to do it. But that was very, very intensive. So you need to have the resources.
So we had at least one full-time person in each country doing analysis full-time, and other people contributing to data collection and stuff. So it depends how many people you have as well as how much time.
Yeah, and we also had a lot of senior people that were quite available to pitch in. And we had full-time field researchers, at least for the data collection period, and then part-time for the data analysis period. Because we were so crunched on time, we couldn't involve the field researchers as much as I would have liked in the data analysis part. But the more experienced qualitative researchers were involved. It's just the ones that were new to qualitative research was a bit difficult to do the analysis with them. In terms of the publications, we actually what we did is at the end of the project, we had a budget for dissemination conferences where we're able to bring in our stakeholders, usually from our policy advisory boards, to the dissemination conference. But then we used the rest of our money to organize a writing retreat with our teams, because we had our 4 teams on there. And so we had, remember, set up for a couple of days, each team apart, and then we had someone from UCL sitting at each, and we were kind of helping them, trying to come up with country-led publications. Different degree of success. 2 countries published quite a lot, 2 didn't. And also it depends about the relationship in terms of dissemination with in countries. So for example, in Mozambique and in Burkina Faso, they had very tight connections with the local stakeholders as well as national stakeholders. So they did a lot of dissemination. They did radio interviews, TV interviews, and so on. So in those 2 countries, the policymakers were actually interested in scaling it up to other districts. But I don't know if you have any other comments about the publication, but it was a long process. And the problem is it happens after the project is finished. So if there's no money to help the countries publish, then it was difficult, I think.
Yeah, we had so there's 29 or 30 authors on that paper so all the country teams in one paper, everyone basically. And so it took a while to coordinate that. We were fortunate to have Shay Abimbola as the editor-in-chief of BMJ Global Health at the time, who was very keen on realist evaluation.
Yes.
We got the paper in there.
So yeah, we got popular, and we got a lot of good feedback as well from definitely realist people in terms of the reviews. The other thing is the participatory component. That is important, but the thing is as well, within MOMI, we had very strong relationship at all levels. And so, and that was needed to really be able to go in depth and test. And the participatory evaluation workshop at the end was really good. We also presented kind of those 4 middle range theories to have the dissemination conference with the policy advisory board. And we got really good feedback as well from that as before we published the paper. And how many CMOs? I think, Tim, you answered a bit in the chat already, no?
Yeah. So general advice is to focus the CMOs down onto kind of smaller areas of the overall program theory, focusing on particular components of the theory, particular groups of people, or particular contexts, so that you get some information really about how that is operating. Ultimately, you want to work out how the program is working for whom in which context. So you need some level of disaggregation between that, and it really depends how complex your intervention is and how many components it's got, how many different contexts you want to know about, how many different groups of people you want to know about in terms of how many CMOs. I think we did actually have quite a lot, and you can
we definitely had more than 30 to start with.
Exactly, yeah. And you can also chain them together in the sense that the outcome of one CMO then becomes a context for the next one that happens. So like in a step.
And actually in our initial CMOs before we went in the field, we tried to do the ripple effect, they call it, but we did very minimally. And then when we actually did the data analysis for the evaluation, we found that there's way more path and more ripple effects than we thought. And that was actually quite interesting work to do. I do like how you can connect all the different components.
Sorry if I exercise my chair's prerogative, just one question, then I'll hand over to Dr. Praveenkumar. At what level did the CMOs originate? Did they come from the country level workshops, or did they come from discussions at a kind of subnational level? At what sort of level did it come from?
It came from a lot of the work, the data that was collected at the baseline. So in that one, that included focus group with different at different levels. So we had community, health facility, as well as district. We had a few national ones, but we also had the policy analysis that were feeding into it. So we really had all levels feeding into it in our initial CMOs.
Yeah, and just on the question of equity and stakeholder involvement and stuff. So this project MOMI actually had quite a long initial period designing the interventions, and so we got a lot of buy-in from community groups, health facility workers, etc. during that stage to design a package of interventions, and then we could draw on that for the evaluation afterwards. Yeah.
Thanks so much, both. You've opened up a lot of questions, which we might need to follow up on with you. But that was so clear. Thank you, Nehla, and thank you, Tim, for answering all the questions in the chat as well. Dr. Praveenkumar, I don't know if you can hear us.
Yes, I can hear you. It was a lovely presentation, Nehla. So yeah, good afternoon, Adri.
Good afternoon, and thank you so much for joining us. You're based at University College Dublin.
Yes, yeah. So let me introduce myself. So I'm Praveenkumar Aivailli. So I finished my Realist, PhD in 2025. So at the moment, I'm working as a postdoc researcher at University College Dublin. So my current project looks into strengthening maternal and child health services in sub-Saharan Africa. So I got introduced to Realist back in 2021. So my entire PhD was on Realist Evaluation of power dynamics in intersectoral collaboration. So it's almost like understanding how intersectoral partners come in and what power dynamics exist between them and how that could impact the intersectoral collaboration. So that was my 4 years of research. And as Nehla was rightly mentioning, Realist takes really long time to finish, and then it's really challenging as methodology is evolving and evolving. Yeah. So should I start my presentation? I mean, or you have...
Please, that would be wonderful. I'm really excited to hear about your work. This is very relevant to our project, as you'll see.
You see my screen?
Yes, it's a bit small, I think.
You have to swap the displays on the very top.
It looks small in Argentina.
Oh,
We'll also see if you have notes. We'll see your notes.
That looks great.
Now it's getting better.
Yeah.
is it better now?
No.
Back to small.
You have to click on the swap displays on the very top so that you can see, because I think you're using 2 screens.
Oh, yes.
Yeah. So if you click on it, go to swap displays, it will show it for you. On the very top where you see show tips up, way up.
Yes.
Yeah.
Is it better now?
It's better.
Perfect.
Okay. I'm really sorry about this, this thing. So, well, my project, this is Realist Evaluation and Power Dynamics in Intersectoral Collaboration. So, just a sec. With bit of a background, what has been known, especially in the space of intersectoral collaboration, is that, the intersectoral collaboration addresses complex public health challenges. A nutrition program is one of such program which uses intersectoral approach to improve the, nutrition status. So one of the program which India was implementing back in from 2018 and 2019 was National Nutrition Mission, where the guidelines said that intersectoral collaboration between health department, education department, and the rural development department, and all the sectors should come in together to address malnutrition issues among children in India. So this was a new program, so that started to implement back in 2018. So during that time of 2018, I was working as a UNICEF program coordinator to implement this program. And after implementing for nearly 2 years, I realized that there is a scope for research, and that's how I ended up doing PhD on this topic. And especially with respect to intersectoral collaboration, factors such as power dynamics significantly influence this intersectoral collaboration, especially with respect to decision making, resource allocation, and as well as agenda setting, which can hamper the program implementation in intersectoral collaboration as well. So when I digged deep into the theory driven in the literature, so I found that a lot of studies have looked into intersectoral collaboration effect, but there were lack of studies on theory driven inquiries to understand much better about what underlying mechanism make this intersectoral collaboration program successful and successful. So that was my this thing. So with respect to question number, I begin my question as how, why, for whom, and in what circumstances power dynamics between the sectors promote or impede the intersectoral collaboration in Assam in India. So Assam is a small state in northeast part of India. It has around 28 states. It's a big state. So the program was being implemented in Assam. So these were my objective, basically to gather empirical evidence on operationalization of intersectoral collaboration in real world setting. And my second objective was to develop and refine the program theory that explain a generative causation of power dynamics. Third is to test my program theory using realist evaluation approach. And lastly, to explore the transferability of refined program theories elsewhere. So as you know already with the realist method, so it follows the realist evaluation cycle. So I began with, first step as a literature. I went to the literature and tried to understand how power influences intersectoral collaboration. And unfortunately, I was unable to find much of the literature which explicitly states that, how power influences intersectoral collaboration. So what I did to build my initial program theories, it's also known as CIPTs. What does CIPT is mean? Candidate initial program theories. So these can come with your literature and with your researchers' own experiences, and also a small exploratory study. So I had a little bit of implementation experience, and I also dig deep into the literature, but I really wanted to position my CIPTs in India and in Assam. So for that, I did a qualitative exploratory study. And one of the problem in global health as well, that there are a lot of theories, but they are largely developed in global north. And I was not comfortable in using the existing theories to start off with. So I really wanted to get those initial program theory from the field. And for that, I did an exploratory qualitative study, and I built, a total 5 CIPTs. Then after that, the next step was to refine these program theory. For that, I conducted a realist review. I went back to the literature and finished that literature review using 23 studies, and I finally ended up in total 6 program theories. So initially I had only 5, but after realist review, I ended up using 6 program theories, and those program theories I tested in a case study in Dibrugarh, Assam. I used in-depth interviews with different stakeholders from different sectors, and I analyzed data using CMOCs and synthesized CMOCs to refine my program theories. So this was my exploratory study, which gave me a first-hand up experience of what does actually intersectoral collaboration mean for implementers and how power influences them. So these were my 5 initial program theory. So initial program theory could be very rough, that could be like a causation and effect kind of a thing, where you literally design your CIPTs such as, if, then, and leading to statement. For example, I'll tell you with my IPT1 and IPT2 is that my initial program theory 1 was during policy design process, if different sectors or a department are given equal opportunity, then sectors feel valued and acknowledged, empowered, and leading to increased participation, coordination, and collaboration among stakeholders in different sectors. So like that, if and then statements were developed, total for 5 program theories. And as I told, I finished a realist review. With realist review, the 6th program theory which emerged. With my qualitative study, I had developed only 5, but only after realist review, the new program theory started to come in. I have included that theory as well for my exploration. So this was my realist review publication, which speaks about total 6 program theories, and then starts the realist evaluation. For realist evaluation, I reached out to different sectors, for example, health sector and women and child development sector, education sector, community, and panchayat raj institutions, and NGO sectors, and academic institutes, and development partners. So all situated in different blocks of within a district. A total 18 mid-level program managers were reached out to test my 6 program theory, which were refined through realist review. As earlier speaker was also mentioning the beauty of interview and data collection. So this is where there is a difference between a qualitative study and a realist interviewing technique. So basically what we use is called a teacher's learner cycle, where you as a researcher put up your program theory and then ask their experience, does it really relate to them? So if they agree, and then you can just confirm those program theory, and if they don't agree, so you can refute or you can elaborate. You can further enrich those program theories. This is known as a realist, the teacher's learners cycle. So I had a multiple source of a data collection. So with one is a realist interview. Second was on observation, how intersectoral committee meetings happen, who speaks, who dominates, and who finally sets the agenda. And I also had a document analysis approach, where I reviewed the meeting minutes and how decisions were made across 3 years. And I triangulated all these 3 data sets to refine my program theory. And I'll take you through one of the examples of sample codes and CMO extraction. Say, for instance, my first program theory, initial program theory, was an inclusive policy development. One of the school nodal officers, while narrating his experience of being involved, he said that I have known that person for several years, and he alumnus of our school, and he consistently informs and invites or meeting and stuff like that. So basically, the whole entire code, you need to identify those key terms of consistently inviting, APIP meetings being invited continuously, and then there is a strong relationship, and then he values our stakeholders and other things, and there is also clear communications, and he contacts me first and stuff like that. So once you have such codes, you can actually start to extract CMOCs. For example, CMOCs, I also followed the Silent Alkins method of dividing mechanism as resources and reasoning. So it's nothing but resource is something which program offers, and reasoning is something which happens in the minds of stakeholders. For example, in my earlier context of how he felt involved, is that in the macro context, National Nutrition Mission was being implemented back in 2018. The state health policy system also aligned to national health policies, and the meso context level and levels were that institutionalized convergent meetings and sudden emphasis on convergence that led to government directives and inclusion of other sectors and APIP platforms. This whole process led that sense of obligation felt by the sectors to adhere to government directives, thus participants in scheduling meeting, and this fosters the environment where stakeholders recognize the importance of cross-sectional collaborations and individual interests. That had led to greater degree of involvement and intersectoral collaboration, and that somehow flattened the power dynamics and sustained collaboration. So once you start to extract the CMOCs, so you will find a CMOC configuration. So when a state health system mandates convergent action, can act as a context number one. It places a sudden emphasis on the institution level. It could act as a context number two, and it results in a regular meeting and stakeholders feeling much more involved, and this fosters a sense of obligations, and resources and reasoning would come and leading to a greater degree of collaboration. So this is my second initial program theory with the leadership support and goal alignment, how a democratic leader could really flatten the curve of power dynamics within a nutrition program that has been explored. Again, I have divided them into context, mechanism, and outcome. So these were just a couple of examples to tell you, how can you build your CMOCs from the interview data. So like that, I have built around 63 CMOCs from 18 interviews to make sense of how power influences intersectoral collaboration. So this is another example of how you need to the steps which I followed for extraction of the data is that getting immersed into the data, you really need to reread all the manuscript, and then you try to code what could be the context that might have triggered this mechanism in those particular situation in NVO, and you try to draft the rough CMOCs, because in Realist you really need a good team to help you understand what could be the context and what could be the mechanism and what are the outcomes which are coming out of our interviews. So the whole process itself requires retroduction and abduction approach, where you really try to read a manuscript and go back a step backward to understand what could be the context that has influenced, and you try to build your CMOCs based on that. So this is how rough and messy it looks where I actually cut all my CMOCs, all 63 CMOCs, and I have put it across and organized into different program theories and demi-regularities. So like that, I have revised all my program theory. I had total 6 program theories. One is an interpersonal relationship. Second is leadership, hierarchy, resources, ownership, and role clarity. So each had its own context, and each had its own mechanism, and each had its own outcome. So now, you might ask, in the realist approach, what's the final outcome? In a realist approach, final outcome is always a middle range theory or a refined program theory, which explains in much better way how the indented intervention tend to work, or the how your research question, for example, mine was on how power dynamics influences intersectoral collaboration, you will have a very rich informative theory to build upon, and also conclude that these are the reasons why power dynamics exist, and then these are the reasons why power dynamics influences intersectoral collaboration. And later you can actually try to link that with already existing theories to make it much more relevant and to make it much more informative. So with that, I also found very nice relationship of these program theories. For example, I revised all my 6 program theories. If somebody wants to use them, they really need to understand the relationship between all these program theories. For example, my first program theory, which is on inclusive policy development, completely relies and depends on leadership. If there are leadership structures, then only this inclusive policy program development might operate. And same with the program theory number 3, which speaks about equitable distribution, completely depends on program theory 1's inclusive development and program theory 2 leaderships. So that's how I found a relationship between all the program theories. This was the first step of developing a middle range theory. So this evidence was also published in PLOS Global Health, where I have detailed out all the CMOs and steps and other things. So interested people can read out. So overall contribution. So what my realist evaluation can contribute to your project. The realist theory moves beyond describing what happens in intersectoral collaboration, and it explains how and why power operates, structural relations and symbolic level, under what condition and mechanism fire on fail. So they provide a replicable analysis framework for researchers working anywhere, especially in LMICs. Maybe it might relevant be to your ECD coalition, Argentina and Ghana as well. So with this theoretical contribution, my theories would explain, can be found relevant to LMIC context. For the practice, people can just use them and then also think of bringing in leadership policies and stuff like that, especially to improve intersector collaboration. And with methodologically, I have developed these program theory. And if anybody in future wants to test these program theories using maybe a CIFR implementation method, or maybe re-aim, and then you can implement and then see what would leads to them. Yeah, this was my presentation. Thank you, and I'm open for questions.
Thanks so